we're going to skip over specific drugs because there's like a billion of them, and that's going to be in a couple weeks after we go through more topics. Pharmacokinetics. Absorption affected by the route and the bioavailability, which is the amount of drug in circulation. Distribution. The first pass effect with oral medication, the concentration reduces, it passes through the liver and whatnot. Basically, it's just about how drugs get absorbed. Are you still texting?
Look at something else.
Okay. So, there's a bunch of notes on these slides on the notes section you'll have to read through. I did these and it took forever, and this is a really big subject. So we're going to kind of skip through some of this, and some of this you'll have to read on your own. So the theories of drugs, there's an antagonist that stops an action, an agonist that starts an action, and an agonist-antagonist that has a higher affinity to start an action and block another. You can alter the metabolic pathways or the effects. There's drug-response relationships, which is the onset of action, the duration of action, the termination of action, which is where it falls below the minimum effect level, where it stops doing what it's supposed to do, and then the therapeutic index level, which is where we base the drug dosages off of. There's a lot of things that affects drugs, age, weight, gender, environment, time of administration, the condition of the patient, genetic factors, pregnancy, all of these things are included. And then there's a cool little table there about the different drug classes that pregnancy falls into. A being no risk, B being small risk, and then continuing down to X, which is bad, bad, bad. Don't give it. Fetal death. We have predictable responses, which are side effects. All drugs have the side effects. And when you give a drug, you want to weigh the risk versus the benefits of giving that drug with the side effects and the different interactions it's going to have. I can't ever pronounce this word. Iatrogenic responses are symptoms that mimic a naturally occurring disease. Example is a UTI after a catheter insertion, or there's this really cool Steve Johnson syndrome that I read about. It looks like a flu or an allergy, but it kills you. And it's really cool. And it's from treatment with penicillin, sulfa drugs, etc. Pretty cool. There's unpredictable ones. An allergic reaction is the most common, which is due to a hypersensitivity to that drug or to an immune response where your body just completely flips out over it. The reason it's important to know also about food and drugs is they can be an indicator of a drug allergy if you've got a food allergy. The example I put up here is like bananas can be indicative of latex allergy, eggs or soy to propofol. And it's also like lactose to like the Advair inhalers and the different propellants. So it can kind of give you a heads up if you know they're allergic to that they may have some other allergies underlying as well, or they could be more likely to have them. Some different reactions, and idiosyncrasy is a completely individual response that one patient has to one particular drug, that is their body. A tolerance is it means they need a higher dose. Their body gets so used to taking the medication that it builds up in their system over time and they need more drugs in order to get to that therapeutic effect. We see it a lot with the narcotics in patients. And a cross-tolerance is when you develop a tolerance to one medication based on the usage of another one, yet again in the opioids and pain medications or in the antidepressants or something along those lines. I put oxy and other opioids. There's tachyphylaxis, which I spelled wrong. My bad. It's where you become quickly tolerant to a medication. You need increasingly higher dose over the same short period of time. But the fun fact is in still giving all of those doses, they need it to get the therapeutic response. However, it still has the same toxic, lethal drug dosage. So just because it takes more of it, they can still die if you give them too much.
Sympathomimetic.
Say it again louder.
Sympathomimetic.
Yeah. I always mess it up. They imitate the sympathetic nervous system like epi. They're often seen with tachyphylaxis. They may have the same toxic threshold with dosages. These are drugs like epi, like I said, that trigger the fight or flight responses. Cumulative effect is an increased effect when the medication is given in several successive doses, possibly resulting in a therapeutic. Can kind of think of those like maybe like the what's it called? The Gardasil shots. They have to take a couple of them before they reach that therapeutic effect. Or allergy shots. Drug interactions is one medication affects another medication, be it a good way or a bad way, like Phenergan and morphine. Phenergan potentiates the effect of morphine. That's in a good way. It doesn't mean the effects stack, but it means that they have reactions to each other. A drug antagonism, when one blocks another, morphine and Narcan. Summation effect, two drugs are given to the patient that have the same effect, which doubles the shown response. A synergism, which would be the morphine and Phenergan. Receive two drugs that have the same effect, but... Oh, sorry, never mind. That was potentiation I was thinking of. The summations, two drugs given to the same patient have the same effect. They double the response. Synergism is receives two drugs that have the same effect, but produce a response greater than the sum of the individual responses. So they work together in a synergism, meaning they both benefit out of it to make a better response. And then potentiation, two drugs that enhance effect. Another fun one that I put up there was Tylenol and alcohol, because they both work on the liver. High doses of Tylenol are given, and alcohol is consumed. It can cause liver damage, causing alcohol-acetaminophen syndrome. Interference is when a drug has a direct biochemical interaction that takes place between them, and inhibition is an effect of one drug that limits the effects of another. It's the opposite of potentiation. And then this is where we get to start skipping stuff, because this is a lot of information. Airway meds. You have the Ulta short-acting non-barbiturate hypnotic agents. You have etomidate and ketamine. Ketamine's a derivative PCP. Etomidate's like the top choice that the book lists out. Sedative hypnotic agents. Propofol. It's an anesthetic, meaning it numbs the area, and it has amnesic effects, meaning you don't remember it. Kind of good. Benzos. Benzos affect GABA receptors in the brain. GABA receptors are one of these things that not everybody knows about, and it's something that's not well understood. And I didn't include my information here, but whatever. It's really cool when you look up information about them, because the mechanism isn't really understood how they work on the brain, but supposedly it like slows down the chemicals. And so there's some examples of some benzos with the doses and all that good stuff. Fun fact, Romazicon is the antidote for the overdose of benzodiazepines. We don't carry it on the trucks. We carry the antidote for opioids. We carry it for mag toxicity. We carry glucagon as an antidote, but we don't carry Romazicon. I always thought that was kind of interesting. We have paralytics. We have non-depolarizing and depolarizing. They work by blocking ACH, which is acetylcholine. And it's the nerve that moves through the synapse, kind of creates the response. And then there's a whole chart of all the drugs listed. This took forever to make. Appreciate it when you read it. This took like 2 hours to make this chart.
Ooh.
I know, and I make all these things too.
That's why I said ooh.
Yeah, that thing was pretty beast. Just take a minute, people at home, to appreciate that. I typed all that up, Scott. It sucks. Anyways, respiratory beta agonists. There's beta 1, which is found in cardiac tissue. Beta 2 is peripheral vasculature in the respiratory tract, so we want to focus more on the beta 2s when we're giving medications. As the dose increases, the beta selectivity decreases, meaning that eventually after you give enough beta 2 agonists, you're going to start to get a beta 1 response. But if the risk outweighs the benefit, like with albuterol and bronchospasms, you go ahead and just keep giving it. A beta antagonism serve no use because you don't want to restrict airflow to the lungs via bronchoconstriction, but it's concerned with beta blockers. God bless it. Alright, albuterol is a sympathetic beta agonist. We've established I can't pronounce that word.
Sympathetic.
Terbutaline Beta-2 agonist. Fun fact, it is also given commonly, it's not FDA approved, but it's also given as a tocolytic.
What?
Tocolytic. Tocolytic is a drug that stops labor, or helps stop labor. Epi is another one. Bronchodilator medications that dilate the lower airways are like Atrovent. They have a long onset time, and they're anticholinergic. There's corticosteroids, which treat inflammation. They are not fast-acting. They take forever to kick in, like 6 hours, but they last for a lot longer, and they can help keep things open in the long run. And there's a list of some. And then here's all the medications. Cardiovascular meds. Alpha adrenergic agonist, alpha blockers. Epi and norepi. Also, Haldol and Trazodone have some effects that can cause hypotension as well. They treat hypertension, glaucoma, and phenocholmycotomas. Basically tumors that produce the catecholine that causes the vasoconstriction. And then I gave you some examples: clonidine, labetalol, etc. Angiotensin converting enzyme inhibitors. These are ACE inhibitors. Angiotensin is a bless America, I can't talk. It's a plasma protein, and it's broken down into renin, and then the renin is what causes the constriction, and all this does is prevent it from converting down its little cascade, so that way it doesn't produce the constriction. And it explains the patho behind all that in this, and then into the notes as well. We're flying through it just so we can see it. Here's a nice little diagram for you with the cardiac cycle. I don't remember why I put that in here, but I'm sure there's a paragraph about it in my notes. Antiarrhythmic drugs, they're based on this really cool classification system. I don't know why they named it like that and why that matters, but they made a big deal about this name. So, Vaughan Williams classification scheme. Class 1 antiarrhythmics, they block the sodium channels and reduce the phase 0. That's why I put that in there. They reduce phase 0, which is right here. And then they're weak, moderate, or strong. The goal is to reduce the rate and magnitude of depolarization. Then we go through all the different drugs and types based on that. Class 2 drugs are beta-blocking medications. I'll give you some examples. Class 3 potassium channel blockers. Amiodarone is a really common one. Class 4 is calcium channel blockers. Adenosin's kind of this special one because it's a nucleotide and it's made from completely different than all the other ones. It's kind of got its own little system. Anticholinergics are used to treat nausea, vomiting, excessive secretions. They're basically treated sludge, salivation, all that good stuff. Yeah, sludge, the acronym. Don't laugh at me. They block the receptors in the parasympathetic nervous system that kind of prevent all this. The side effects are listed, and everything's in there. Catecholamine sympathomome. God bless, I can't talk.
Where are you at? I blinked. Where are we at?
We're right here.
Sympathomimetic.
Say it again louder.
Sympathomimetic.
Sympathomimetic. These are like tripping me up. Alright. So I listed some of these out. Dopamine's one of them. It's got positive inotropic effects that stimulate the beta. It also stimulates alpha at higher doses and can cause peripheral vasoconstriction. Basically, they do vasoconstriction, increase of cardio output, the blood coagulation increases, skeletal muscle strengthen, and large airways are dilated. So it has a lot of different things that it does. Ones that we have: epi, dobutamine, neocephalin, and norepi. And they're all listed out here with some fun little facts about each. Direct vasodilator medications, hydralazine, also known as apresilene. It acts directly on the arteries to produce the vasodilation. Diuretics, we all know Lasix. It helps remove the drugs from circulation by altering the distribution in the body. So it pulls them out, puts them in the vasculature, then they go into the kidneys and excrete it out through the kidneys. And it helps to get extra fluids out. They also have Bumex listed in Mannitol. Mannitol is it's one that can help pull the fluid out. What?
That's my favorite.
Mannitol. It's an osmotic diuretic, so it pulls the tissue from the brain. What? Pulls the fluid from the brain. Not the
Brain
tissue.
salt.
I know.
I
know, I'm sorry.
It's okay.
It's been a really long day.
It has been a long
Do
day.
you know if you give mannitol, you have to have special tubing?
Yeah. Fancy one.
So if you don't have the tubing, you do no mannitol?
We have nitrates listed. Then we have anticoagulants, aspirin, Plavix, glycoprotein, I've never heard of it, but it's super aspirin, whatever. Heparin, Lovenox, warfarin, thrombolytics, or the ACEs, ACEs being the suffix ASE. They break down clots. All this is included in your notes. We're just skimming through it because there's so much information. We have colloids. It's a high concentration of electrolytes in blood. It increases the osmotic pressure called the fluid to be drawn into the intravascular space. We have blood products, albumin, hetastarch, dextrin. God, there's so many of these. I wasn't kidding when I said there were 60-some styles. There's a haloperidol for anti-psychotics. These are anesthetics, anti-anxiety, sedatives, and hypnotic drugs. We have anticonvulsants, phenytoin, and Cerebrix. These can cause arrhythmias, but they're great for helping to treat seizures. Hence listed under anticonvulsants. What we do carry is we carry Versed, so we don't carry diazepam anymore. What? Okay. Barbiturates, phenobarbital. These are the pain meds. There's a whole bunch of them. We're just going to fly through these. GI medications, they're histamine-2 blockers. There's a whole bunch of information provided here on these. There's Tagamet, Pepcid, Zantac. They each work on a different histamine receptor, and they help reduce the acid production. There's antiemetics. There's Zofran. And a whole bunch of other stuff. We pretty much did death by PowerPoint. What's up?
Want to grab Welch for me?
No, I don't want to go Welch.
Oh, I want to go to Welsh.
Have fun, be safe.
We'll try. As long as I don't get blown off the road, we'll be alright.
It's that funny. It already happened in Chesapeake.
Alright, we're done. I'm not doing death by PowerPoint anymore. That was 30 minutes.
Oh, 30 minutes already?
Ish, yeah.
Hey, have you heard of any EMS people giving Pepcid with their epidrips for anaphylaxis?
I have not.
Apparently that's like a new thing. Because they give the epi,
Histamine-Blockers.
Benadryl, and then they give the Pepcid. One came in the ER the other day from some place. They were a trauma patient, and they had an allergic reaction on the way. And they had Pepcid in their drug book, so it's like...
That's good.
Because the nurse was like, "Did you crush it up and put it in a bag?" They're like, "No, we have it."
Alright, the other thing we can do...
Jeopardy.
You want to do Jeopardy?
Do we get the money?
Well, I don't have any money.
Want to be Sean Connery?
Oh, you don't have the money?
I don't have any money.
You have like cookies instead of money?
I want to be Sean Connery.
I didn't bake cookies or cupcakes this time. I thought about it.
What?
I know, I baked
I'm out.
cupcakes the last time, but nobody ate them.
That's because you baked 10 million of them.
I baked 24 because it's a batch.
We'll all have diabetes if we eat those.
I'm working on it as it is.
Alright, I'll pull up Jeopardy. We can play Jeopardy.
I like Jeopardy.
I'm also on Jeopardy.
Give them music too.
I don't have the music, but I can put on the Disney play
Oh,
song.
we can sing. Wait a minute, there's only 2 of us in here.
Yeah, so you're on your own.
Schroeder, it's me or you.
Well, I hate to tell you, you're probably going to win.
Not today.
I gotta download this from PowerPoint. What is down?
I really want to play the part of Sean Connery.
I like to solve the puzzle.
No, close. That's close.
I'll just go.
No whammy?
Alright. Who wants to go first?
Ooh.
Alright, Scott.
Pick him.
I'll go first.
Alright, go. Pick a topic.
Oh, you didn't say that. I said
Well, yeah, you gotta pick a topic and a number. That's how Jeopardy works.
circulation. That's big ball. It's 50.
Oh,
Alright.
Lord.
Name a psych drug that has alpha receptor blocking effects.
Your mother.
Lithium. Oh, what is lithium? I don't know. It's just
I got nothing.
Hello. We just went over that.
Oh, that we give.
Try to know. Yeah.
Oh. Lithium does too, doesn't it?
So you make any money.
I'm already 50 in the hole. Hell yeah. Can I say hell?
Yeah, why not?
Okay.
Alright, Scott, your turn.
Oh, my turn. Let's do respiratory for 10.
Alright, respiratory for 10. Which receptor is responsible for bronchodilation? What?
Doesn't he have to answer it?
No, you have to.
Well, I have to answer it.
It's your turn.
Oh. Clearly, I've never played that pretty. Alright, so it's respiratory, so there'll be 2. The beta 2.
Beta 2? Yay.
That was so small. His was like huge.
I know.
Thanks for noticing. I appreciate
You
it.
said word art.
Alright, let's see. I guess we'll do respiratory for 20.
Name that drug. It's approved as a bronchodilator, but it also is used for its tocolytic
Oh,
properties.
I can't say it, but it's terbutaline-ish.
Yeah.
Whatever that word,
See,
yeah.
look, that's big and bold.
That's what she said.
You're getting bigger.
Alright, so Scott has 30.
Oh. Circulation for 10.
Wait, I skipped myself. But that's
Oh.
okay. When you miss one, I'll
You're Vanna.
I'm not beta. I'm
Close. Close. She's Alex Trebek.
Alright, name that
Okay.
drug.
Alpha and beta blocker given in hypertensive crisis and used with OB patients.
A couple things come to mind. I mean, the first one I'm thinking is Labetalol.
You have 5 seconds.
Oh, well, let's go with that then.
Labetalol?
Okay, that's right.
Yay.
Yeah, you got it. I lost track. It's also
Okay, see, I was like, well, how
Hydralazine
which
is also
one?
an acceptable answer. So how much money you got now? 40?
More than.
$40.
I got negative 50.
I guess circulation for 20.
Describe the MOA for ACE inhibitors.
Oh, mm-hmm. Oh, Can I phone a friend? Yeah. Shrugs.
Well, they
Let's hear your beautiful voice.
inhibit the ACE.
Screw the maintenance. I knew until that popped up.
And you're done. Work by blocking and slowing the conversion of angiotensin.
See, I
1
told
to
you they-
angiotensin 2 that's-
They inhibited the
It's 1 and
ACE.
2. Okay, that's what it is.
Alright, it's my turn. I'm going with bloody stuff and neuro for
Oh.
10.
Don't we have to like ring in though? Like, dirt.
No, I don't think you have to do that for Jeopardy.
Jeopardy, yeah, like they read the question and say true or false. Ask
We
for
have so much time.
Fibrolytic.
No. It goes to the person that answers first. Then
In
if they don't
Jeopardy?
get it, yeah. And then if they don't get it, then the other two people can ring in.
Oh, okay. Alright.
I don't know if I should be allowed to play this though, because I made this, so I know all the answers.
Alright, that's what I said.
Alright, so Shards, here's your question. Is aspirin a fibrolytic?
True.
No.
False.
You got to play with Craig or Visa.
I was close.
It doesn't thin the clot or break up.
I was
It
close.
just keeps them.
He used to get like half of the money. He's close.
It's a 50-50 shot.
Alright, Scott, you have 40.
Oh,
And you're in the hole.
Hell yeah. What was it? Which one was that one? Was that 10 or 20?
That was 10.
Hell yeah, negative 60. This is golf, right? I'm winning.
Alright, Scott.
I guess let's do bloody stuff in neuro for 20.
Bloody stuff in neuro for 20. It's a derivative human blood colloid solution. Name that drug.
A derivative of human Dex 10. No, it's not Dex 10.
5.
They get 30 seconds on Jeopardy. I'm just saying. And the truck almost backed into the building, so I should get a few more seconds. Distractions.
Shit, it's
FFP.
Now it's how you run.
That is FFP.
I got that wrong too. I didn't ring in.
Close enough.
Alright, Schroeds. I think you made up some money.
Dation for 10.
You know that's gonna be hard.
Name that drug. This medication can cause induced delirium. It is a derivative of PCP.
Oh.
It has bronchodilator effects.
Motherfucker. Oh, I'm sorry.
Pick me.
I know this one. Yeah.
5, 4.
It's that white stuff.
Alright, Scott.
It's ketamine.
Yeah.
Not that white stuff.
Alright, Scott.
Negative 70.
Oh no. I guess sedation for 20.
How does succinylcholine work?
It makes them shut the hell up. Oh, probably not the right response.
Let's call it work.
So, it's an induction agent for RSI.
Yeah, but how's it work?
And I gotta talk it out.
Okay.
So you give it, and this sucks when you push it, you'll see them fasciculate, it's working. And that's what you use for your paralytic. To paralyze them.
It's a non-depolarizing muscular agent, meaning that it
keeps
the muscles from repolarizing, then that causes the paralysis.
I was going to paralytic agent myself, too.
Give a sedative first.
No.
Or not if you're...
Butthole. You can say butthole, it's okay.
It's recording.
Alright, Andy.
Go, Andy, go. Go, go, go. It's your turn.
GI and fluids.
Oh, God. Here we go.
30.
30.
I'm trying to get for negative 100.
What is responsible for nausea, vomiting, body system, and or location?
Tequila and Mexican.
I like his answer.
You can name the part in the brain, you can name the body system.
The Thomas.
We should click the answer. Let me look at it real quick.
That's not how Jeopardy works.
It is. Sometimes.
Sometimes.
I'm playing on my phone. Oh, right. Okay. It's... What is...
It's the pawns. It's the middle of it.
Yay, negative 10. Or negative 100.
It works on the dopamine and D2 receptors.
I was
Look at the
getting there.
vestibular system. Alright.
This shit. Stuff. Sorry.
Scott, your turn.
Ooh.
That wasabi just kicked in. I'm not crying.
Crying.
How do we know what's been picked or not?
I don't know, we're just kind of trying to remember. We've done 10 and 20, 10 and 20, 10 and 20, 10 and 20. Nada.
30.
So I guess we gotta do respiratory for 30.
What effects does epi have on beta receptors?
Bronchodilator.
Okay.
When the alpha beta, yeah. That's one.
It's an agonist. Bronchodilator. So I'll give it to you.
Yay.
What's that next?
I guess respiratory for 40.
Name a risk of prolonged usage of albuterol.
Tachyarrhythmias.
Is that what you want?
That's one of them. I don't know if it's a risk. Yeah.
Oh, this was it. No, I skipped too far ahead. I'm sorry. Metabolic acidosis and hypokalemia. Okay.
I wonder though at what point, like how many treatments?
A lot.
More than we have in the box, though.
A lot more. You have a box. Alright, Andy.
Huh?
You're at negative 100.
The GI fluids for 10.
What receptor do GERD medications target?
That's 10. That's like a $40 question.
We went over this. We
won't
specifically said it.
listen. We won't listen.
He talked about it too.
Who?
You did.
I did.
Yeah.
I did not.
You did too. I can rewind the tape and show you where you talked about it.
The receptors that...
Oh.
I don't know.
It's the histamine thing.
Yeah.
Yeah.
H2.
The H2s. Yeah. Mm-hmm.
Alright, Scott.
Oh, I thought it was my turn.
I suck at this, that's why.
Andy, go ahead and pick another one.
Yeah, you pick it on, Andy.
GI fluids for 20.
We're going to answer it, too.
C.
Name 2 signs and symptoms of hypocalcemia, which are an indication for receiving calcium chloride or calcium gluconate.
What? Tired.
I know. I don't remember the answer to this one either.
Yes, you do.
No, I don't.
Hypocrisy.
I'm not with altered mental status. That's a symptom of everything.
Oh my god. First cardiac output?
Okay.
Your shit's gonna flop. Your stuff's gonna floppy. I don't know.
Arrhythmias, I'll give you that.
Hypotension.
Seizures to increase.
Are you going to pick another one?
Let's just finish it out. GI out of fluids for 40.
Alright. Sodium bicarb is the antidote for
Death.
Stuff.
Do you need a hint?
That would be helpful.
It's a psych med. It's a classification of psych meds.
Tricyclic Antidepressant Overdose.
Yeah.
Will be one of them. What else is there?
Okay, so you finish.
I did that one already.
Here we did.
Oh,
Not the end. Oh.
beta blocker.
Well, we did. I'm sorry. Alright, we're down to these categories. Scott, your turn.
What category? Bloody stuff for 30.
What conditions are thrombolytics used to treat?
Thrombolytic. Like an MI.
Okay.
Strokes. MI.
Mine is ischemic CVA.
Yeah.
So what kind of CVA would you not give these for?
Hemorrhagic.
Did you know I had a patient die in the back of the truck because they did that?
Why'd you kill him?
I didn't. Montgomery did.
You killed him.
Montgomery Regional did. They gave
What?
TPA to a patient with a hemorrhagic stroke.
They didn't scan him?
They did.
Oops. That's bad.
That's really bad. Her brain went like
Where'd you pick him up from?
Montgomery.
Oh, well, that's not bad for them.
She didn't make that one. Alright, what's next? Scott, here you go. Name that drug. It has sedative effects, has extrapyramidal symptoms, often give Benadryl to prevent, and it's used as an antipsychotic.
Haldol.
Ding, ding, ding.
Do we don't give it with Benadryl though, do we?
We do. It's
We do?
protocols. Yeah.
It's CPTS?
Yeah. Benadryl also potentiates the effect of Haldol.
I'm
There
thinking
is a
pain
path-
medicine and Benadryl, like they do in Brems.
Yeah, no. There is
What?
a reason behind it, but I don't remember the patho for
Why
it.
did you do
If you
that?
get morphine and Brems, you get Benadryl.
Well,
It potentiates it, and you come in and you're like this.
Yeah. There is a patho behind it, but I don't remember it off the top of my head. But Benadryl helps with Haldol.
We give Versed, Haldol, and Benadryl.
Alright, Andy, your turn. Describe the cardiac benefits of morphine.
yeah, I don't know. I'm supposed to know this.
Oh.
You know this one.
It decreases the preload.
It's really a simple thing. What does it do?
Oh, it's a vasodilator.
Yeah.
And decreases the oxygen demand.
That's what I was looking
You
for.
did, it does decrease.
See?
Yeah.
I got something right.
I'm going for.
I should get 110 points for that.
Are you positive now?
Huh?
Are you in the positives now?
Yeah, I'm back at 0. Actually, no, wait. I'm sorry, like -10, but I'll take it. I'll say back at 0.
Okay. So see if you can get 30 points. Where does LASIK works in the kidneys?
In the loops of your mama. Henley, or whatever the. Yeah, see?
Yeah, you got
Ah!
it. Good job. Good job.
The one damn thing I
It works
remember.
by antagonizing the ACH receptors, blocking the what? Oops.
I don't know where the heck you at.
I don't know.
I want points for not saying hell.
Scott,
What are we doing?
you want circulation for 40 or 50 or respiratory or sedation?
40.
Oops.
Hey, there's your answer.
If they had a heart transplant.
Yes, that's also true. That answer is given to you, so you pick this one. Name a psych drug that has alpha blocking receptor. That blocks alpha receptors. God, I can't talk.
Oh, Wellbutrin would. That's not all of them though. Hold on.
Is that your final answer?
No, it's a bunch of them. Well, how though? Oh, are there like drugs we can?
Actually, this wasn't fair because we already answered this question. You got it wrong the first time too.
Do I?
Son of a Smith. I say we just call this game. It's done. You won anyway.
And Alpha versus Third Black.
Got one. Oh, wait, no. We gotta go back.
No, we
No,
don't.
we gotta go back.
Yeah, we didn't finish.
We did.
We had 30.
What effects does it have?
No, we did that one.
We did that one.
We did
We did that one. We did that one.
There you go. Drugs are given as prophylaxis in combination with other drugs.
So, Fran. That's what they're looking for.
Antiemetics. Technically, I'll give you that. They also work on GABA receptors to cause a sedative effect.
Oh,
I forgot.
like Benadryl. Well,
Oh, benzos.
benzos.
Benzos. They're given as prophylaxis. Like RSI drugs?
But this doesn't say for what, though.
Yeah, I'll give you that. It's not a specific question.
Are we sedating or tubing?
I think the hint was the GABA receptors.
Wait, I want a good hint. Who made this PowerPoint?
What's a sign that... Alright, here's your last one. Name a sign and symptom that judge your patient is not properly sedated.
He's talking to you.
That's a really good sign or symptom.
He's talking to you.
If they fail the eyelash test, they still have a gag reflex. Or they could be tachycardia.
Two. But both of y'all are right. Yours is That's Jeopardy.
That's Jeopardy. Oh, it's just 8 o'clock.
Huh? The last thing I had prepared was some test questions.
Uh-oh, test questions. Here we go.
Alright. Apparently my child's being really bad tonight, by the way.
Wow.
She spit at the waitress at the restaurant. She spit her food at her.
No. I gotta get some ice for my gin and juice.
You gotta see what?
Get some ice for my gin and juice.
We'll do 3 questions and then we'll call it. 3 questions. You have to read them and guess the answer, Andy.
Are they listed?
Yeah. It's multiple choice.
Oh, shells, yeah, I can do that. That's why I got to the medic test.
No, it's like...
It is.
Alright, this is the last step. Pick a question, a page number, and a question.
Mother Fletcher.
It's completely random because I just randomly picked these out of this book. So I don't know the
Is
answers.
that H7? What the heck is that?
Where? Do you see that?
What is that, if 7?
That's page 187. My handwriting is questionable, but that's not why we're here.
Well, just to keep it interesting, we'll do page if 7.
Question 11. Alright.
That says 30.
Oh.
Can you not read your own handwriting?
I can't, honestly, sometimes. It's really bad. Alright, wait for Scott to come back, and then you get to read this question
That's a really long one.
out loud, and then get the answer.
Can I start reading now?
No, you gotta read it out loud, and
I'm
Scott's
reading
gotta
out
be able to
loud.
hear it.
I'll read it out loud.
Alright, because I don't know the answer either.
A lot of big words.
It's a lot of big words. It's a hard time. That's why you gotta read it out loud, too, so we can help you. Me and Scott will help you, but you have to read it out loud.
There he is, the man with the answers. Oh, Lord.
Last thing we're doing tonight,
Plan.
pick a page and a question, and we're gonna answer it together.
I already picked out if 7.
Oh, Lord. Is
All
it
right.
like on pharmacology, or is it just like...
It's Pharm.
Okay.
It's Pharm from all different sections of this book.
Yeah, I picked out a really long one now.
Yeah, now you gotta read it out loud.
Can I pick another one out? You have been requested to transport a 32-year-old male IV drug, or do you want me to say the whole? Sorry. You have been requested to transport a 32-year-old male intravenous drug user who was brought to the ED without vascular access, with a history of having had a witnessed generalized tonic-clonic seizure 10 minutes prior to your arrival. The patient arrived post-ictal but responsive. No other medical history was available. On examining the blood pressure is 130/80. Heart rate is 88. Respiration's 14. Oxygen saturation 98%. On room air. The head is atraumatic. The pupils are 4 millimeters and reactive. Cardiopulmonary exam was normal. Neurologically, the patient is oriented to person only. He has no facial asymmetry. Moves all 4 extremities. Deep tendon reflexes were +4 symmetrically, and no Babinski reflexes were present. The blood sugar is 110. While looking for venous access over the patient's scarred extremities, the patient began a second generalized tonic-clonic seizure. What is the best first-line therapy for acute seizure management? A. Phenytoins, B. Phenobarbital, C. Fosphenytoin, or D. Benzodiazepines?
D. Benzo.
That's what I was going to go with.
What do you think, Scott?
What's the options?
A. Phenytoin, B. Phenobarbital, C. Fosphenytoin, D. Benzodiazepines.
I think because he's an avid drug user, benzo's probably not going to work.
What is it?
But they're your first line.
Phenobarbital.
The best first-line therapy for acute seizure management.
All right, go to the answer.
Where's the answer?
Typically benzo, but with him, probably pheno.
What?
You gotta go to the answers.
Phenobarbital? Where? My God, where are the answers at?
No, not in the back.
Well, you tell me where the answers are.
Just keep going to the end of the chapter, and then they're numbered. You don't go all the way to the back of the book.
I'm used to that.
See, that's the fun in this. Is it's completely randomized because I don't know what's going on.
Mother lover.
And then you get to read the answer and the rationale.
I guess we're hard to start with the benzo.
Nope, you've already circled that answer with a Sharpie. You're done.
Ha!
I'm thinking pheno.
D. Seizure types are organized according to whether the source of the seizure within the brain is localized, partial or focused onset seizures, or distributed, generalized
You don't
seizures.
have to read all that if you don't want to.
No, read that.
Will you make up your mind?
God said you have to read it.
Partial seizures are further divided on the extent to which consciousness is affected. Simple partial seizures and complex partial seizures. If consciousness is unaffected, then it is a simple partial seizure. Otherwise, it is a complex partial seizure. A partial seizure may spread within the brain, a process known as secondary generalization. Generalized seizures are divided according to the effect on the body, but all involve loss of consciousness. These include absence, myoclonic, clonic, tonic, clonic, and atonic seizures. A mixed seizure is defined as the existence of both generalized and partial seizures in the same patient. Generalized epilepsy, leading to the status epilepticus, is mostly seen in the acute state in one of the two situations, with generalized encephalopathy, including that immediately following trauma, and in patients who are known epileptics who have reduced drug intake and whose blood levels have fallen below therapeutic concentrations. Use a benzodiazepine as the first-line therapy. Seizure management requires a risk-benefit analysis that balances the patient's needs with the urgency of the situation. Lorazepam is the preferred first-line agent for seizure control due to its long-lasting anticonvulsant properties. Diazepam is equally effective, but requires that a concomitant, long-acting anti-seizure medication be administered, such as Dilantin.
This is a whole page.
I know! When the IV access is unavailable, alternate routes such as IM injections of midazolam, rectal solutions as diazepam, and IM fosphenytoin should be considered. Of the three, IM midazolam is probably the fastest and easiest to use. Alternative agents, that have been used to manage seizure activity include phenobarbital, lidocaine, etomidate, propofol, and paraldehyde. Paraldehyde?
Where is it?
The last word, lover. Paraldehide.
Okay. I didn't realize it was a whole page. Alright, pick one for me. And then we'll let Scott pick one.
Pick one for you?
Yeah.
The longest one I can find. Ha, 269.
269?
Yes.
What question number?
I don't know.
Oh, there's only one.
50.
Your patient ingested an unknown toxin. The ECG recorded on ER admission shows a minimally irregular wide QRS tachycardia with a long QT. The most likely cause is TCA overdose, early digitalis overdose, calcium channel blocker overdose, or beta blocker overdose. A longer QT is the key word.
Beta blockers is slower.
I know, but it's...
So, calcium channel blocker overdose?
Isn't it TCA that causes a wide QRS?
Sure.
A wide QT?
I wasn't listening at all.
Read it again.
Alright.
Alright. Unknown toxin was ingested. The ECG shows irregular wide QRS with a long QT. Was it a TCA, digitalis, calcium channel, or beta blocker? I think TCA. He thinks beta blocker.
Dig.
You think dig. Alright.
TCA. It's TCA. You said wide QRS and what?
Long QT. Oh my god, I'm not reading all this.
You are.
Oh, yes, you are. That's 2 pages worth. I don't feel so bad now.
Tricyclic antidepressants, commonly called TCAs, have been prescribed since the 1950s for depression. Scott's not even listening and you're texting. I'm not reading this.
No, I was reading my messages.
Since 1950, they've been prescribing the TCAs, and that ain't working because people still jumping. Keep
Boom.
Examples are tofranil, Alavil, and Pamelor.
tofu.
Tofranil.
Oh,
That's why they're depressed.
Tachycard sinus tach, the result of anticholinergic effects, often occurs with therapeutic doses of TCA. It has been a poor marker for serious toxicity. In small studies of patients with acute overdoses, QRS prolongation, probably a manifestation of quinidine-like effects of the drugs, was a better predictor of seizures and ventricular arrhythmias that was a serum drug level. Sodium loading may be an important factor in the reversal of the symptoms of the cyclic antidepressant toxicity. Prolonged QRS is often the most indication for serum alkalinization in the TCA toxicity. Although beta blockers were once contradicted in CHF, they have a potential to worsen the condition. Studies in the late 1990s showed their positive effects on morbidity and mortality in CHF. Bisoprolol, Cardivolol, and sustained release metoprolol are specifically indicated as adjuncts to standard ACE inhibitors and diuretic therapy in CHF. Glucagon has... I'm cheating. I skipped a paragraph.
The whole thing. Whole thing.
Beta blockers are known for their reductive effects on heart rate, although it is not the only mechanism of action or importance in CHF. I'm trying to read this and sound exciting. Mm-hmm. Beta blockers, in addition to their sympathetic B1 activity on the heart, influence the renin-angiotensin system in the kidneys. Beta blockers cause a decrease in renin secretion, which in turn reduce the which reduce the heart oxygen demand by lowering.
If you want to entertain people, you should read that as if you were talking on the phone.
And increasing the oxygen carrying capacity of blood. Beta blockers, sympatholytic.
My God, I don't know what you're saying.
Whatever.
Where you at?
We get it.
Where
We're
you
done.
at?
We're done.
Where
okay?
you at? No, you gotta read the whole thing.
I'm not reading the whole thing.
we don't
Where are we at?
understand.
I'm down there somewhere. Down there.
Don't make me restart this thing.
We're not restarting it.
Where's it at?
Lowering the extracellular capacity of the
Beta blockers.
sympatholytic.
Beta blockers, sympatholytic. I can't see if you're picking my phone up. Thank you. Beta blockers sympatholytic activity reduce heart rate, thereby increasing the ejection fraction of the heart despite an initial reduction in ejection fraction. Glucagon has been used in the treatment of overdose. Glucagon has a positive inotropic action of the heart and decreases renal vascular resistance. It is therefore useful in patients with beta blocker cardiotoxicity. Cardiac pacing should be reserved for patients unresponsive to pharmacological therapy. The most widespread clinical usage of calcium channel blockers is to decrease the blood pressure in patients with hypertension, with particular
particularly efficacy in treating
What? Efficacy.
treating
In
elder
treating
patients
elderly patients.
with a relatively low blood pressure. The afterload of the heart decreases. I can't do that. That makes me dizzy. This channel blocker, frequently used to control heart rate, prevents cerebral vasospasm, and reduce chest pain due to angina pectoris. Most calcium channel blockers decrease the force of contraction of the myocardium. Calcium channel blockers work by blocking voltage-gated calcium channels in the cardiac muscles and blood tissue. This decreases intracellular calcium, calcium leading in the reduction of muscle contraction. In the heart, it decreases the calcium available for each beat, results in a decrease in cardiac contractility. It is because of the negative inotropic effects of most calcium channel blockers that they are avoided or used with caution in individuals with cardiomyopathy. Many calcium channel blockers slow down the conduction of electrical activity within the heart by blocking the calcium channel during the plateau phase of the correction action potential of the heart. They result in a negative chronotropic effect, resulting in a lowering of the heart rate and the potential for a heart block. The negative chronotropic effects of calcium channel blockers make them a commonly used class of agents in individuals with atrial fibrillation or flutter in whom control of the heart rate is an issue. Treatment with calcium channel blocker toxicity involves intravenous calcium, atropine, fluids, insulin, and inotropes. Insulin is required because of the high-dose calcium channel blockers block the effect of insulin. Bam! Scott, it's your turn.
Well, I'm glad.
I'm not reading anymore. Tell me.
This one I gotta read.
Uh-huh.
Gotta read it out loud. Pick a number and a question.
312, 22. Oh wait, no, I read that question before.
We'll get back to that later.
What's the C word?
Wish I had money. Get some meat on the way home.
Alright. When managing preterm labor, all of the following medications can decrease or stop uterine activity except aprisilene, or however you say that, mag sulfate, terbutaline, or NSAIDs.
Read the question again.
Aprisilene. I don't know. It's one of the two.
When managing preterm labor, all the following medications can decrease or stop uterine activity except for NSAIDs, terbutaline, mag sulfate, or aprisilene.
I think it's either aprisilene or NSAIDs.
I was thinking that's it.
I think it's aprisilene, though, because NSAIDs are an anti-inflammatory. So the uterus has to be inflamed somewhat when it's ticked off and in labor. Right?
Well, I don't have any uterus side effects.
Oh, there's only one person in this room who's actually been through labor before.
I mean,
I had an epidural. I didn't actually experience labor. It was very uncomfortable.
alright. It would be hydralazine. Acts by relaxing arterioles and decreasing vasospasms. And
That
as a
wasn't an
result-
option.
I think it's Alprazolam.
That's what aprisilene.
Aprisilene. Oh, I thought you said hydralazine. I was
You
like,
did.
those are two
I
separate
did.
things.
Yeah, that's what he said.
Hydralazine and aprisilene?
Yes.
They're two separate drugs.
Ha! You
What?
knew that.
It's not. It's the same thing.
They're the same drug?
Yeah.
Oh, well, we learn something new every day.
And as a result, it reduces blood pressure and stimulates cardiac output. Hydralazine is recommended when the diastolic blood pressure is 100 or greater. 2 milligrams administered intravenously every 5 minutes until the diastolic blood pressure ranges between 90 and 100.
That was your question?
That was my question.
Read another
What in
one.
the holy flesh?
Read another one, Scott.
Well, that's not fair. I gotta read two.
We read whole pages, okay?
Yours wasn't even a paragraph.
Page 256, 1.
I'm glad you could read her handwriting. Jeez.
Oh. This is a good one.
Okay.
I remember this one. There's a long explanation too.
Come on. You gotta read the question and answer to us. Like, we gotta work together on this.
Sí, señorita.
Hey, is it just me or is my hair getting blonde?
Sí.
Well, you said it, not me.
Shut up. Seriously, it's all dark except this one piece.
Lord. Okay.
Okay, are we even now?
You were transporting a 38-year-old man. Transporting. A 38-year-old male who was presented to the ER with a history of cocaine-induced tachycardia and is complaining of mid-sternal chest pain. I wonder why. Vital signs are...
We don't give labetalol.
What?
Is that the answer?
What?
We don't give labetalol.
That ain't even an option.
Okay.
Vital signs are as follows.
I think
Temperature of 101.2 degrees Fahrenheit. Blood pressure of 200 over 100. Heart rate of 140. Respirations at 28. O2 saturation of 97% on 2 liters of oxygen via nasal cannula, if you're wondering. Which of the following medication is contraindicated for management of this patient?
Labetalol.
It is, but it ain't an option.
I know. What do you
You
got?
got nitroglycerin,
if you stop talking, you get to
morphine
him.
sulfate, metoprolol, and midazolam.
Metoprolol. That is low pressure. That one.
Is that your final answer?
Yeah.
Or this is my long response. So yes, it says beta blockers must not be used in the treatment of cocaine, amphetamine, or other alpha adrenergic, I can't say that word, stimulant overdose. The blockade of only beta receptors increases hypertension and reduces coronary blood flow, left ventricular function, cardiac output, and tissue perfusion by means of leaving the alpha adrenergic. How do you say that word?
Adrenergic. Adrenergic.
System stimulation unopposed. The appropriate antihypertensive drugs to administer during hypertensive crisis resulting from stimulant abuse are vasodilators like nitroglycerin, diuretics like Lasix, and alpha blockers like phenethylamine. Although benzos and nitro are first-line agents in drug-induced acute coronary syndromes, cocaine-induced vasoconstriction also is reversed by phenethylamine. Therefore, AHA 2005 guidelines recommends phenethylamine as a second-line agent. Cocaine stimulates both the peripheral and central nervous systems. The drug is metabolized by the liver and excreted by the kidney. With excessive or prolonged use of cocaine, the drug can cause itching, tachycardia, hallucinations, and paranoid delusions. Overdoses cause tachyarrhythmias and a marked elevation of blood pressure. Toxicity results in seizures followed by respiratory and circulatory depression of medullary origin. This may lead to death from respiratory failure, stroke, cerebral hemorrhage, or heart failure. Cocaine is also highly pyrogenic because the stimulation and increased muscular activity causes greater heat production. Heat loss is inhibited by the intense vasoconstriction. Cocaine-induced hyperthermia may cause muscle cell destruction, resulting in renal failure. These can be life-threatening, especially if the user has existing cardiac problems.
Yay! We did it, guys.
Never mind, the thing stopped recording about half an hour ago.
No, I didn't.
Oh.
It's
Yeah?
still going.
It's still going?
Make it stop.